Hi, Dr. Caroline. Welcome to our presentation on dengue hemorrhagic fever. I am Gensing from Group 4, and today we will explore its profound impact on global health. Hi, let's meet my team. I am Gensing, and I am excited to introduce our dedicated team members, Azrin, Karens, Haoyue, Moniba, Ruba, Ashad, and Sarah.
Now I will be talking about the introduction of this case study. This case study revolves around a 15 years old boy who was admitted to a hospital with a myriad of symptoms including fever, persistent vomiting, severe abdominal pain and rapid breathing. Upon further investigation, it was discovered that he also exhibited nasal and gingival bleeds on the day of admission. Prior to his hospitalization, the boy experienced fatigue, severe headaches and high-grade fever for 5 days. Notably, none of his family members displayed similar signs or symptoms, and he had no recent travel history. Given his active lifestyle, which involves playing outdoor sports daily, it is crucial to delve deeper into the possible causes of his condition. This presentation aims to explore the case of study, discuss potential diagnosis and propose diagnostic tests and treatment options. I will ask questions to make us understand better of this case study. First, what kind of outdoor sports does the patient play, and are there any specific location where he frequently plays? Secondly, are there any other symptoms such as diarrhea, constipation or changes in bowel habits? And lastly, are there any similar symptoms or medical condition in the patient's family history?
So based on the provided case study, the most probable diagnosis that can be made is simply dengue fever. And the reasoning behind that is that all common symptoms of dengue fever are seen, such as the high fever, the persistent vomiting, the abdominal pain, not to mention the nasal and gum bleeding, which are also bleeding manifestations often seen in dengue, and not to mention the symptoms that were there from 5 days prior, such as the fatigue or the headaches. As for the lab test results, abnormalities were seen in the high white blood cell count as well as the low platelet count, aka thrombocytopenia, which is a hallmark of dengue infection. And the lack of recent travel history suggests that it is a locally acquired case of dengue fever, which is often common in Malaysia. The rapid breathing, bleeding manifestations, and thrombocytopenia indicate a more severe form of the disease, possibly severe dengue. As for the lab test results, abnormalities were seen in the high white blood cell count as well as the low platelet count, aka thrombocytopenia, which is a hallmark of dengue infection. And
Dengue hemorrhagic fever is caused by the dengue virus, which is part of the Flaviviridae family and Flavivirus genus. There are 4 distinct serotypes of this virus, DEN 1, DEN 2, DEN 3, and DEN 4. Each serotype is antigenetically unique, meaning infections which one serotype does not confer immunity against the others. Consequently, an individual can be infected up to 4 times once by each serotype. Multiple infection with different serotype significantly increase the risk of developing severe forms of the disease, such as DHF and dengue shock syndrome (DSS). Structurally, the dengue virus is a small spherical envelope virus with a diameter of approximately 50 nanometers. Its genome is a single-stranded positive sense RNA molecule, about 11 kilobases in length, encoding 3 structural protein and 7 non-structural protein. The envelope protein is crucial for viral entry into host cell and is the main target of neutralizing antibodies. The pre-membrane or membrane protein is involved in virus maturation, and the capsid protein forms the viral core. The 7 non-structural proteins, NS1, NS2A, NS2B, NS3, NS4A, NS4B, and NS5, are vital for viral assembly, replications, and evasions of the host immune response. Dengue virus transmission primarily occurs through bites from infected female Aedes mosquito, particularly Aedes aegypti, and to a lesser extent, Aedes albopictus. This mosquito thrive in urban environments and breathe in stagnant water found in artificial containers. When a mosquito bites a viremic person, it becomes infected. After an incubation period of 8 to 12 days, the virus multiplies within the mosquito, which can then transmit the virus to other humans through subsequently bite. The infected mosquito can continue to spread the virus for the rest of its life. The feeding habits of Aedes mosquitoes, which can bite multiple individuals in a single gonotrophic cycle, facilitates the spread of the virus among human populations. Factors such as temperature, population density, and mosquito control measure impacts dengue virus transmission. Higher rainfall and warmer temperatures enhance viral replication and mosquito reproductions, leading to increased transmission rates. Additionally, urbanizations and poor water management create more breeding sites for mosquito, accelerating the spread of the virus.
Dengue hemorrhagic fever (DHF) pathogenesis involves a complex interplay between the dengue virus and the host immune system. Transmitted by infected Aedes mosquito, dengue virus primarily targets dendritic cell, macrophages, and monocytes, leading to a systemic infection characterized by widespread viral dissemination. The host immune response, while initially aimed at controlling the virus, can paradoxically exacerbate the condition through the excessive production of cytokine, resulting in a cytokine storm that causes significant inflammations and tissue damage. Endothelial cell dysfunction is a hallmark of DHF, where increased permeability of the endothelial cell leads to plasma leakage edema and hypervolumic shock. This dysfunction is further exacerbated by thrombocytopenia, where the destruction of platelet and intercoagulation increase the risk of severe bleeding. A critical factor in DHF pathogenesis is antibody-dependent enhancement, which occurs during secondary infection. In this process, non-neutralizing antibody from a prior dengue infection facilitate enhanced viral entry into immune cell, leading to increased viral replication and a more severe immune response. Clinically, DHF present with high fever, severe headache, myalgia, rash, and hemorrhagic symptoms such as petechiae and epistaxis. Severe cases can progress to dengue shock syndrome characterized by rapid weight pulse and hypotension, necessitating urgent medical intervention. Additionally, host genetic factors including polymorphism in immune response genes and specific human leukocyte antigen HLA alias play a significant role in increasing the risk and severity of the disease, highlighting the importance of genetics predisposition in the pathogenesis of DHF.
Now I'm going to talk about some of the tests that are used to confirm the diagnosis for dengue hemorrhage fever. So number one is RT-PCR. Now this test is recommended within the first week of the illness to detect the viral RNA. So this test is highly sensitive and specific, making it a preferred method for the early diagnosis. RT-PCR basically identifies the viral DNA, allowing for its detection even when the concentrations are low. So this method provides a definitive diagnosis of dengue infection during the acute phase. Moving on to NS1 antigen test. So the NS1 antigen test basically detects a non-structural protein NS1 that is produced by the dengue virus. NS1 basically can be found in the blood during the early phases of the infection, typically from the first day of the fever up to day 9. Now, this test is valuable for early diagnosis as it can identify the virus before the antibodies are produced by the body. Last but not least, IgM and IgG antibody test. IgM is a serological test that identifies the IgM antibodies in response to the dengue infection. So, IgM antibodies basically become detectable from day 3 to day 5 of the illness and peak around these 2 weeks. They indicate a recent infection. As for IgG antibody, these antibodies appear later than IgM, generally after the first week of the illness, and remain in the blood for a long time. So the presence of IgG antibodies can indicate past infection or secondary dengue infection. So these tests are useful for understanding the patient's infection history and immune response.
So let's talk about some signs and symptoms that was not talked about in the case study. We have blood vomiting, arthralgia, lethargy, pain behind the eyes, muscle pain, lymphadenopathy, bleeding under the skin, cold extremities, and restlessness. To give an example of what one of these specific signs or symptoms means, we can look at arthralgia. Arthralgia is a symptom in which the joint of the patient is very stiff and hurts for it, which causes multiple issues as well.
Let's talk about the treatment options for dengue hemorrhagic fever. Proper management is crucial to improve patient outcomes and reduce complications. Let's go to the various treatment options. The primary goal is to closely monitor vital signs, fluid balance, and hematocrit levels. This allows for early detection and management of complications such as shock and bleeding, which are critical for patient survival. To replace lost blood in cases of severe bleeding, blood transfusion helps maintain hemoglobin levels and improves oxygen delivery to tissues. Next, we have fluid replacement therapy. Is to manage dehydration and maintain blood pressure. This therapy prevents shock, maintains blood volume, and stabilizes the patient. To alleviate symptoms and improve patient's comfort, pain and fever management reduces fever and pain without increasing the risk of bleeding. Then we have platelet transfusion. Is to manage severe thrombocytopenia. Platelet transfusion reduces the risk of severe bleeding and helps in clot formation, which is crucial for stopping hemorrhages. To correct electrolyte imbalances caused by dehydration, electrolyte replacement maintains proper cellular function and prevents complications such as arrhythmias, which can be life-threatening. Finally, we have oxygen therapy to support patients experiencing respiratory distress or hypoxia. It ensures adequate oxygenation of tissues and organs, which is vital for patient survival and recovery.
According to the WHO, there are several methods to prevent dengue hemorrhagic fever. Firstly, it is to repel mosquitoes, which includes the use of mosquito repellents, coils, and vaporizers. The usage of mosquito nets soaked in mosquito repellents and the usage of window screens are also highly encouraged. Secondly, it's through the elimination of mosquito breeding grounds, such as covering all water storage tanks with lids, adding insecticides to all water storage tanks outside of the house, and to always dispose stagnant water from all artificial habitats. This is because one of the life stages of mosquito is the larva and the pupal stage, which requires water to complete their life cycle. Additionally, there are also some guidelines for tourists who are traveling to tropical countries where mosquitoes are active, including to avoid outdoor activities 2 to 3 hours before daylight and 3 to 4 hours after nightfall, as well as wearing long sleeve shirts and long pants while going out, and as much as possible to stay indoors during nighttime in an air-conditioned room. Additionally, the use of mosquito spray is also highly encouraged.
In conclusion, whenever we see symptoms like high-grade fever, persistent vomiting, severe abdominal pain, rapid breathing, nasal and gum bleeding, they all point towards dengue hemorrhagic fever. It's caused by dengue virus transmitted by Aedes mosquitoes. Several tests like RT-PCR, NS1 antigen test, IgM and IgG antibody tests are used for its diagnosis. As for the treatment, it primarily focuses on supportive care. In combating dengue, prevention is the key, so we must use insect repellents and remove stagnant water where mosquitoes breed. To brief everything up, we can say awareness, prompt diagnosis, effective treatment, and stringent preventive measures are essential in managing and controlling the disease.
Before we conclude, I would like to share the reference that inform our research on dengue hemorrhagic fever. On behalf of Group 4, thank you for watching. I hope you enjoy it.